Welcome to BHIS 546, Leadership Development in Health Informatics. I am Dr. Miriam Isola, the lead instructor for this course, and this video is to give you a short overview of what we will cover in the course and how we'll work together over the next 8 weeks. This course is offered to provide you with insight into leadership within the healthcare industry, and particularly as it relates to health informatics. Leadership is a vast subject with many books, workshops, and graduate programs all devoted entirely to this subject. Leadership is also one of the 10 knowledge domains that accredited health informatics programs must cover. An interesting question to think about is health informatics leadership different from leadership in other industries? We'll be exploring that and other questions as we go through the course. The UIC Health Informatics program prepares students to bring a strategic perspective and also to effectively communicate for motivation, direction, and guidance of stakeholders in the health informatics arena. For the next 8 weeks, we'll be looking at leadership theories and practical application of theories through case study reviews. At the same time, we'll work to develop your understanding of your own leadership abilities. We all work under leadership, from top executives to the departmental level managers. Many of us will have opportunities to be leaders at some point in our careers. All of us will have opportunities to show leadership at some point in our work. This course will touch on this entire continuum, examining leadership at the 30,000-foot level and then at the personal level. This class is designed to provide you with usable knowledge of leadership theory and practice. While the course will not provide a perfect recipe for leadership success, it will supply you with the resources and opportunities to discuss leadership from a range of perspectives. You'll also be provided with a foundation for continuing study of leadership, as well as building your personal capacity for leadership development and growth in the HI arena. What are the leadership roles in health informatics? At the top of many healthcare organizations in the C-suite, they include leaders across clinical and information technology areas, such as a chief medical officer or a chief medical information officer, a chief nursing officer or a chief nursing information officer, or a chief health information officer. These are some of the titles that we often hear about at the top level. Other leaders can be found at the departmental level, such as health information management, pharmacy, or laboratory. Many employees take on leadership roles for HIT projects, such as implementing an EMR or an analytics platform. And then we will also discover in this class that we can all participate in leadership activities, sometimes as a leader and sometimes as a follower. In this course, you will explore your own leadership strengths. Are you more strategy-minded? Are you strong at building relationships? Do you have a strong desire to pursue learning and continuously improve? These are all different aspects of leadership skills and leadership capabilities. You will think about how you can leverage your strengths and make your biggest contribution. I have worked with leadership in many healthcare organizations as a part of my career as a healthcare consultant. I've served in leadership roles in hospital administration, IT, and currently I'm the director of this health informatics program. I've also created my own healthcare consulting company focusing on healthcare data analytics. So I will be working to bring my experience to bear on this subject as we explore leadership in health informatics. It's true for most of us that we have experienced poor leadership in organizations where we have worked. This is unfortunate and sometimes painful when it occurs, as it can make your job harder and your work less productive and less enjoyable. However, I have found I've learned a lot from seeing poor leadership too. It is sometimes this example that's easiest to recognize because of the impact it has on our daily lives. It's not always easy to recognize a good leader. We'll look at some examples of very successful and visible leaders in healthcare today. These leaders are having an impact on our field, which is very dynamic and at a point where there are many innovations and changes going on. So part of leadership in health informatics is navigating organizations through these periods of change and transformational and innovative leadership. So we'll explore questions: what is good leadership in healthcare and what makes a leader successful? The syllabus outlines our topics for the course, and we're going to start off with Foundations in Leadership and then move into some specific theories in situational leadership, transformational and innovation leadership, ethics, critical leadership skills, team leadership, and organizational change leadership, which, as I said, is very important for the work we do in health informatics because our industry is always changing. We will use 2 textbooks, the Leadership Theory and Practice book by Peter Northouse and the Strengths-Based Leadership by Tom Rath. Each week in this course, you'll complete readings, watch some videos to learn about the topic. The assignments will be a combination of some written work, some group discussion, and case study analysis. Also, at the end of each unit, we'll ask you to reflect on what you've learned and apply it to a particular question or scenario. This is what we call an application self-reflection. In previous courses, you may have done something similar in a minute paper, but in this course, we place more emphasis on application, and we look for your thoughts on how these topics that we're discussing every week apply to the work you will do in health informatics. For this class, you will also complete 2 short analytical papers, one about your own leadership strengths and one about a well-known healthcare leader. Finally, there is a minute paper for each unit that asks for your anonymous feedback on your learning experience. To get started, I encourage you to review the syllabus and the point values document, which can be found under the rubrics link, and this will help you to understand the requirements for the course. I hope you enjoy the next 8 weeks as we take a deep dive into leadership in health informatics.